Today we are going to discuss about two of the new anti-obesity drugs or weight loss drugs. So one is injection of semaglutide, Ozempic, so that is known as semaglutide Ozempic. Second is the injection of Tirzepatide, that is known as Mounjaro. So this is Mounjaro. So what is the importance of this is Mounjaro, Tirzepatide, this is semaglutide Ozempic. So what's the importance of anti-obesity drug? What is obesity? Whenever a person grows in fat, it is known as obesity. How do you define obesity? Obesity is defined by body mass index. So how do you calculate body mass index? It is weight in kilogram divided by height in meter square. Think of a person like me who is having a height of 175 centimeter. My weight is 85 kilogram. So what is my body mass index? Weight in kilogram divided by height in meter square. So 85 kilogram is my body weight. My height is 175. So weight in kilogram by height in meter square. So 85 divided by 1.75 into 1.75. That is 85 divided by 2.89. So approximately my BMI comes to be 38 to 39. So whenever you have a person with body mass index more than 30 is considered as obesity. So you are having a person with a height of 150 centimeter. What's the optimal weight for the height of 150 centimeter? It is height in centimeter minus 100. That is 150 minus 100, 50 kilogram. So likewise, my height is 175 centimeter. My optimal weight for my height is 175 minus 175. My weight now is 86. So in that manner also I am overweight for my height. So obesity is roughly assessed by body mass index. So BMI more than 30 is obesity. BMI between 25 to 30 is considered as overweight. So previously, any person who comes with a body weight, let it be female who gains body weight after delivery, let it be young guy 30-35 years who changes his workplace from India to some other external country having weight gain, they used to come to an endocrinologist, especially doctors like us, endocrinologist, and ask, doctor, I am gaining weight like anything, I am not eating that much, still I am gaining weight, check my hormone. So we used to think that hormone causes weight gain. Now studies shows that only 10% of weight gain is associated with hormone. Which are the two hormones which can cause weight gain? One is thyroid, second is cortisol, and some people with sex hormone deficiency or hypogonadism can also have weight gain. But 90% of weight gain is due to metabolic syndrome. It is not hormone that cause weight gain. Some people eat half chapati, still they gain weight. Some people, in spite of eating 25 or 30 kubus or cup of chapati, they never gain weight. So that is known as metabolic syndrome. Some people eat half chapati, that is stored by the body. Some people eat 25 chapati or 30 chapati, that is burned by the body. So basically, whenever a person has a BMI more than 25, it is overweight. More than 30 is obesity. 90% of obesity is metabolic syndrome, governed by your dietary risk factors, lack of exercise, as well as your metabolic rate, which is covered by your genetic factors. Suppose a person who is having a BMI more than 30, a lady who comes at the age of 25 years, who is preparing for marriage after 6 months, she wants to shed her weight by almost 30 to 40%. What are the treatment options? Number one is diet, physical activity, lifestyle. And dietary intervention is the cornerstone of weight loss. So a person having diet, physical activity, exercise, and change in lifestyle, and how many percentage of people lose weight. In spite of having a good diet, exercise, lifestyle, only 30% of the people lose weight. Remaining 70% of people who are low metabolizers, metabolic syndrome, never lose weight. So those people, there was no treatment available in the past except going for surgery. Suppose a lady is having a height of 150 centimeter. Her age is 25 kilogram. Age is 25 years. So height is 150 centimeter. Optimal weight for the height of 150 is 150 minus 150. Suppose her body weight is 100 kilogram. She needs to reduce her body weight by 50 kilogram. What is the option? Suppose she is going for diet, exercise, lifestyle. Still she is not able to lose more than 5 to 10 kilogram. She has to lose body weight by 50 kilogram. Previously, we used to send the patient for a bariatric surgery, either a banding or a bypass, where people used to lose 30 to 40% of body weight. So invariably, a 100 kilogram person can lose 30 to 40 kilogram, and she will land in a body weight from 100 to 60. But we know invariably surgery is always a surgery. 90% of people who are having obesity are not willing to go for surgery. And ultimately, what are the complications of bariatric surgery? People lose weight. Definitely, people lose weight by 30 to 40%. So 100 kilogram person loses weight by 40 kilogram, or a 50 kilogram person loses weight up to 30 kilogram, that is 20 kilogram weight loss. But invariably, surgery is a surgery, and 15% of the patients who undergo bariatric surgery, either a banding or bypass, have some complication of the surgery, either a surgical complication of a reflux or a vitamin deficiency, calcium, vitamin D, B12, magnesium, zinc, and another sometimes hormonal imbalance. And remaining 15% of people have a regaining of weight gain 5 to 10 years after going for a surgery. So roughly understand, Obesity is BMI more than 30, BMI 25 to 30 or 25 to 29.9 is overweight. 90% obesity is due to metabolic syndrome. Only 10% is hormone cause. Suppose you want to lose your body weight, first and foremost is diet, exercise, lifestyle. In spite of having a diet, exercise, lifestyle, people, almost 70% of the people are not able to lose weight. They usually previously used to go for a bariatric surgery, but surgery is a permanent procedure. Many people are not willing for surgery. 15% of the people have some vitamin deficiency. Remaining 50% have a rebound weight gain 5 to 10 years after surgery. So diet, physical active lifestyle, and between surgery and before surgery, there is only one option: drug therapy. Previously, there was no available drug for treatment of obesity. We had only one available drug, orlistat. That's an intestinal lipase inhibitor that is known as Semaglutide or orlistat, which can reduce body weight by 5 kg. But none of the people want to lose just 5 kg. A 100 kg lady taking a tablet to lose 5 kg, that is not worthwhile. Suppose a 100 kg lady needs to reduce her weight to 65 or 70, she has to either go for a bariatric surgery or a tablet. There is no tablet which reduces the body weight more than 5 to 6 kg. There the injections came, two injections, that is Semaglutide, Ozempic. So this is Semaglutide, Ozempic. This is given in dose of 1, 2 mg and 2.4. Then the latest injection came, that is Tirzepatide. The molecule is Tirzepatide. The trade name is Mounjaro. So what is the importance of this injection? These injections came to the market in 2021 as treatment for type 2 diabetes. Especially type 2 diabetes people who are obese, fat. So they used to take insulin, again gain weight because insulin causes appetite, hypoglycemia and weight gain. Then these two injections were used and launched, that is Semaglutide, Ozempic and Tirzepatide, Mounjaro. How does this work? These injections act by cutting off the appetite and reducing the fat cells. And what is the percentage, how to use it? So first the injection that came to the market was Semaglutide, Ozempic. 1 mg pen is there, 2 mg is there. So you are taking one injection of 1 mg per week for 4 weeks, then increasing to 2 mg per week. That is, it is a weekly injection. So to this Monday you are taking 1 mg, one injection you are taking. Next Monday you are taking 1 mg, another injection. Third Monday you are taking again 1 mg. Fourth Monday 1 mg. Then you are increasing to 2 mg. So it's a weekly injection. So how much percentage of weight loss can occur? 15% of weight loss minimum occurs when you take 2 mg of Semaglutide or Ozempic. So 15% means 100 kg person within 6 months loses 15 kg of body weight. And then the second injection came, that is Tirzepatide or Mounjaro. So Mounjaro, there are 3 strengths. This is a strength which I have shown 12.5, 5, 10, 12.5, 15. So subfractionation, just understand, don't understand in detail. This Mounjaro is Tirzepatide. The dose is 2.5, 5, 7.5, 10, 12.5, 15. So first injection is Semaglutide or Ozempic, which is given in 1 mg per week for 4 weeks, then increased by 2 mg. You take it for 6 months, people lose 15% minimum. So from 100 kg, they will land in a body weight of 85, but many people lose 20 to 30 kg body weight. Second, which is little more effective by comparative trial, is Tirzepatide, that is Mounjaro, that is given usually in 3 strengths, 5, 10, 15 mg. So usually Mounjaro or Tirzepatide, initially we start on 5 mg per week for 4 weeks. So 5 mg injection we ask them to take for 4 weeks. After 4 weeks, we increase the dose to 10 mg per week again for 4 weeks. Then after 2 months, we increase to 15 mg for a period of 6 months. And what is the percentage of weight loss with Tirzepatide or Mounjaro? 5 mg produces weight loss of 15%. 10 mg produces weight loss of 19.5%. And your 15 mg produces weight loss of 21%. That is 100 kg person. A lady comes with a body weight of 100 kg. She is taking 5 mg of Tirzepatide or Mounjaro for 6 months. She loses 15% of body weight, that is 15 kg. She is taking 10 mg for 6 months. She loses 19.5% of body weight, that is 19.5 kg. She takes 15 mg for 6 months. She loses 21% of body weight, that is 21 kg. So the minimum weight loss with Semaglutide or Ozempic is 15 kg. The minimum weight loss with a Tirzepatide or Mounjaro 15 mg is 22 kg. So gone are those days where people used to lose 5 kg by injection or 5 kg by tablets. Now they lose 20 kg theoretically, but practically people lose 30 to 40 kg. You ask me, Dr. Bobby, how many patients you have started? Probably Semaglutide or Ozempic I have given for more than 35 patients. Or Tirzepatide, Mounjaro, I have probably given for almost 20 to 22 patients. And what's the minimum weight loss? You don't have to tell at all. People lose weight, people have to lose weight because it invariably acts by cutting off the appetite and reducing the fat cells. So you ask me, Dr. Bobby, if you discontinue, what's the consequence? If you discontinue, 50% of people regain the lost weight within 6 to 12 months. One of my patients who was having a body weight of 120 kilogram took Mounjaro for 6 months. After 6 months, he came to me with a body weight of 92 kilogram, that is 28 kilogram weight loss. Then he was so super confident that he was thinking that it's not the tablet, the injection has helped him, Mounjaro has helped him, but his exercise has helped much more. So he stopped Mounjaro and continued the vigorous exercise. But after 6 months, again the rebound weight gain occurred. He landed in a body weight of 112. So Mounjaro, he was able to lose weight by 28 kilogram. When he stopped Mounjaro, he regained 20 kilogram. 8 kilogram he could maintain by doing a diet and exercise activity. So whenever a person is obese, previously we had no other option, go for a diet exercise, failing, people go for a bariatric surgery or a liposuction. Now at least you have 2 drugs available, that is Semaglutide or Ozempic, Tirzepatide, Mounjaro, and is it safe or not? Semaglutide, Ozempic and Tirzepatide, Mounjaro are approved for use in children about 12 years. Irrespective of LFT, RFT, age about 12 years, anyone irrespective of liver, kidney function, you can start Tirzepatide, Mounjaro, but don't give Tirzepatide, Mounjaro or Semaglutide or Ozempic in people with a family history of thyroid cancer, that is medullary carcinoma and thyroid are meant to, otherwise it's totally safe. What are the side effects of the drugs? How does this drugs work? Is it safe for the liver, kidney? Irrespective of the liver function, kidney function, age more than 12 years, anyone with a BMI more than 30, you can start a Tirzepatide or Mounjaro, which loses body weight by minimum 22 kg, or a Semaglutide or Ozempic, which loses body weight by minimum 15%, that is 15 kg, both you can start. What are the side effects? The mechanism is by cutting off the appetite. So initially people can have a nausea, vomiting. You take 10 chapati in the morning after taking Ozempic, 1 milligram for 2 weeks, or a Mounjaro 5 milligram 2 weeks. People tell, doctor, my stomach is full like anything, doctor. I see 5 chapati, I take 1 chapati, my stomach is full. Some people take 2 biryani in the no, they see biryani, so they take 1 pound of biryani, your stomach is cut off, because the actual mechanism is cutting off the appetite and reducing the urge for the food by reducing the gastric empty. So the side effect is anorexia, nausea, vomiting. Some people constipation, diarrhea can occur in 15% of the people. That is 100 people taking that, 15 out of 100, or 10 people taking that, 1 to 2 out of 100 may have a nausea, vomiting, diarrhea, constipation, but usually it gets regressed in 90% in the patient of 2 to 3 weeks. That is why don't start Ozempic in a higher dose of 2.4 milligram per week, or Mounjaro directly to 15 milligram, always up titrate. We start Mounjaro in 5 milligram per weekly for 4 weeks, then 10 milligram again for 4 weeks, then 15 milligram, then continue for 6 months to 1 year. Because rapid increase in dose, you have a higher chance of nausea, vomiting. So it's a safe drug irrespective of liver function, renal function, age more than 12 years, anyone can try it. 15%, 100 people uses it, 15 out of 100 can have initially nausea, vomiting, constipation. That's the mechanism where you are having continuous, it subsides in 90% by a period of 3 weeks. Weight loss occurs to the tune of 15 to 25%. Practically people lose, everyone who take it lose. Mounjaro, especially people who take it, lose 25 to 30 kilogram. Maximum weight loss occurs in 6 months. So you lose up to 20% to 25%. So 100 kilogram person becomes 75 if you take it continuously by the end of 6 months. When you stop it, rebound weight gain occurs in almost 50%. So always titrate it and then look. Suppose you continue, do you continue to have a weight loss? No. You continue to have to wait for the injection for at least 4 years. You can continue to have a persistent weight loss, but the persistent weight will be maintained. To reduce the weight further, you have to go for a good diet and exercise activity with a GLP-1 now. So this in short to find out whether this is available in India or not. Many people come to me in India and ask, doctor, can we buy Ozempic or Mounjaro from UAE, or can we send someone buy it and come? Now this has become Semaglutide, Ozempic and Mounjaro, that is Tirzepatide, is an OTC drug. Yesterday also I went to a pharma and just asked for Mounjaro. They are immediately giving. It's an over-the-counter drug. You don't require even a doctor's prescription. Any person with a BMI more than 30 invariably can take it. So basically, cutting in short, understand, we don't have Semaglutide, Ozempic or Tirzepatide, Mounjaro available in India. We have in India oral Semaglutide or oral Ozempic, that is known as Rybelsus tablet. Rybelsus tablet is available in 3, 7, 40 milligram, which can cause weight loss up to 5 to 8 kilogram. Whereas injection of Semaglutide, injection of Ozempic, 2 milligram. Rybelsus you have to get up early morning, take half glass of water, 1 tablet of oral Semaglutide, Rybelsus 14 milligram, wait for 30 minutes for take any food fluid or any other tablet. So Rybelsus is the oral formulation of Semaglutide or Ozempic, 14 milligram per day. You have to take it on empty stomach every day. Weight loss occurs to 5 to 8 kilogram. Whereas injection Semaglutide, injection of Ozempic, 1 to 2 milligram you have to take once in a week only. Irrespective of the time of the, you take Monday, next Monday you have to take morning, evening, intake. weekly once only, where you lose weight by 15 to 20%. That is 20 kilogram to 25 kilogram. Whereas oral Semaglutide or Ozempic, you lose weight by 5 to 8 kilogram only. And when is this drugs going to come in India? Semaglutide or Ozempic by Novo Nordisk is probably going to come in India by 2026. Whereas Tirzepatide Mounjaro by Eli Lilly is getting launched in India probably by the mid of 2025. Will it be bombarding the market? Invariably it will be bombarding the market, because we have millions of people who want to lose 20 to 30 gram body weight, who are not willing to go for a bariatric surgery in spite of going for a good diet, exercise, physical activity. They are not able to lose weight, they are depressed like anything. For them, these are the wonder drugs. And what are the additional benefits compared to weight loss and sugar control? Some people tell me, okay doctor, I lose 20 kilogram, my sugar comes down, and what's the additional benefit? It is reducing hypertension, hyperlipidemia, albuminuria. It protects the heart and kidney, obesity, sleep apnea. Now, December 12, US FDA has given approval for Tirzepatide or Mounjaro in people with severe sleep apnea. Moderate to severe sleep apnea, it reduces the use of CPAP by 50%. So other than weight loss and sugar control, control of hypertension, hyperlipidemia, albuminuria, heart protection, kidney protection, weight loss, sleep apnea, fatty liver reduction, and abdomen circumference. Your waist circumference comes down by 4.7 centimeter. And now trials are going on where Tirzepatide, Mounjaro, and your Semaglutide or Ozempic reduces Alzheimer's disease progression by 20 to 30%, and both reduces fat liver by almost 62%. So basically understand, obesity is not always due to hormone. 10% of obesity is only due to hormone, 90% is metabolic syndrome. So whenever you are striving for weight loss, you are not achieving a weight loss. Only one oral tablet available was oral Semaglutide, that is Rybelsus, which can lose body weight by 5 to 8 kilogram. Now injection Semaglutide or Ozempic, Tirzepatide, Mounjaro, both are coming to India. Both are available in GCC countries. But if it is not available in India, you can always go for a diet, exercise, weight loss, hormone evaluation. You can start an oral stat, it's an intestinal lipase inhibitor which reduces weight by 5 kg, and oral Rybelsus which loses again by 5 to 8 kg. Total 10, 12 kg to 13 you can lose, but still your GLP-1 log always works. This is in short about obesity and the latest treatment other than obesity management by bariatric surgery. Bariatric is always good in a person who wants to lose 50 to 60 kg of body weight. Suppose a lady is 150 kg, she wants to make the weight 80 kg. You will not lose 70 kg by taking Ozempic or Mounjaro. You lose 20 to 25 kg. Suppose you want to lose 50 to 60 kg of body weight and not go for a bariatric surgery, either a banding or a bypass, whereas a modest weight loss of 10 to 25 kg invariably is attained by Ozempic or Mounjaro or Tirzepatide. This is in short about weight loss treatment. Thank you.